I need every woman over 45 watching this to listen carefully because what I'm about to share could save your life or the life of someone you love. Breast cancer is the most common cancer among women worldwide. In Nigeria, it accounts for nearly 28% of all female cancers. Here's what most women don't know. Your risk dramatically increases after age 45. The hopeful truth that gynecologists want you to understand is that when breast cancer is caught early, in its earliest stages, the survival rate is 99%. 99%! That's not luck. That's the power of knowing what to look for and acting quickly. Today I'm sharing 5 early warning signs of breast cancer that every woman over 45 must know. These aren't just medical facts, these are the specific signs that leading gynecologists say women often dismiss or miss until it's too late. Some of these warning signs might surprise you, especially number 4, which 70% of women don't even know is connected to breast cancer. All medical information and studies referenced are listed in the description below. And please remember, this is educational content only. I am not a doctor. If you notice any of these signs, you must see a healthcare professional immediately. Before we begin, here's my question for you. Have you had a mammogram examination in the last 2 years? Tell me in the comments. Your answer might remind someone else watching to schedule theirs. And if you want more life-saving health information like this, hit that subscribe button and turn on notifications so you never miss a video that could change your life. Now, let's start with warning sign number 5, one that many women notice but dismiss as something harmless. Number 5, changes to the nipple, including inversion, flattening, or pulling to one side. Your nipples have been the same shape and position your entire adult life. So when gynecologists say to watch for nipple changes, they mean any deviation from what's normal for you. This could be a nipple that suddenly starts to pull inward or turn to one side, flattening where it used to protrude, or developing an unusual shape. In Nigeria, a 46-year-old woman in Abuja had a similar experience. She noticed one nipple was becoming flatter compared to the other. Her mother encouraged her not to ignore it. That conversation led to early detection and successful treatment. Gynecologists recommend doing a simple mirror check monthly. Look at your nipples straight on and from the sides. Check if they're in the same position, have the same shape, and point in the same direction. Any change, even subtle, deserves medical attention. It's important to note that some women are born with inverted or flat nipples, and that's completely normal for them. What matters is change. If your nipples have always been a certain way and suddenly something is different, that's when you need to get checked. The next warning sign is one that often gets dismissed as a normal part of aging, but gynecologists want women to understand when it's actually something more serious. Number 4, persistent, unexplained breast pain or discomfort in one specific area. Here's something that confuses many women. Most breast cancers don't cause pain in the early stages. In fact, pain-free lumps are more concerning than painful ones. However, and this is critical, there's a specific type of pain that gynecologists say women should never ignore. We're talking about pain that is persistent, stays in one specific spot, doesn't change with your menstrual cycle, and has no clear cause, like an injury or poorly fitting bra. This focused, ongoing discomfort could indicate inflammatory breast cancer or other aggressive types that do cause pain. A 53-year-old woman in Jos, Nigeria, experienced a burning sensation in one area of her breast for 3 weeks. It wasn't severe. She described it as a persistent ache she couldn't ignore. She initially thought she'd strained a muscle. When it didn't improve, she saw her doctor. Tests revealed inflammatory breast cancer, which is more aggressive but treatable when caught early. Her decision not to dismiss the pain gave her the best chance at successful treatment. Gynecologists want women to understand the difference between common breast pain and pain that warrants investigation. Hormonal breast pain typically affects both breasts, feels like overall tenderness or soreness, and follows your menstrual cycle. Concerning pain is usually one-sided, focused in a specific area, and persists regardless of where you are in your cycle. If you're over 45 and postmenopausal, any new breast pain should be evaluated since hormonal breast tenderness typically decreases after menopause. Here's what to do. Track the pain. Note when it started, where exactly you feel it, how long it lasts, and whether anything makes it better or worse. This information helps your doctor determine if further testing is needed. And remember, the absence of pain doesn't mean there's no cancer. That's why regular self-exams and screenings are essential even when everything feels fine.
Before we continue, if you're finding this information valuable, please hit that like button right now. And make sure you're subscribed with notifications on so you don't miss the next video in this series, where we'll cover the risk factors that increase your chances of developing breast cancer and what you can do about them. Now let's talk about warning sign number 3, the one that surprises most women because it doesn't seem related to breast cancer at all. Number 3, swelling, thickening, or a lump in your armpit, often appearing before any breast changes. This warning sign catches many women completely off guard. They're checking their breasts, but not paying attention to their armpits. Yet, gynecologists say that swollen lymph nodes in the armpit can be one of the earliest detectable signs of breast cancer, sometimes appearing even before a tumor in the breast itself is large enough to feel. Here's why this happens. Your breast tissue actually extends into your armpit area. Your lymphatic system, which helps your body fight disease, has clusters of lymph nodes in your armpit that drain fluid from your breast. When cancer cells break away from a tumor in the breast, they often travel first to these nearby lymph nodes, causing them to swell. The swelling might feel like a small, hard lump or just a general thickening in the armpit area. It may be tender or completely painless. It's different from the temporary swelling you might notice when you're fighting a cold or infection, which typically affects both armpits and goes away within a week or two. Gynecologists recommend checking your armpits as part of your monthly self-exam. With your arm relaxed at your side, use your opposite hand to feel the armpit area. Press firmly in small circles, checking for any lumps, hard spots, or areas that feel different from the surrounding tissue. Then raise your arm and check again, as this can make certain areas easier to feel. Important note: swollen lymph nodes in your armpit can be caused by many things besides cancer, infections, reactions to vaccines or medications, or other benign conditions. But the rule is simple. Any swelling or lump that lasts more than 2 weeks needs to be evaluated by a doctor. Don't wait. Don't assume it's nothing. Your armpit is trying to tell you something important, and listening to that signal could save your life. The next 2 warning signs are ones that most women do know about, but there are critical details about each one that gynecologists say women often get wrong. Let's start with number 2. Number 2, unusual discharge from the nipple, especially if it's bloody, clear, or occurs without squeezing. If you're not pregnant or breastfeeding, any discharge from your nipple deserves attention. But gynecologists want women to understand that not all nipple discharge is equally concerning, and knowing the difference can help you respond appropriately. Here's what matters. The most concerning discharge is bloody or blood-tinged, clear and watery, or discharge that comes from only one breast, particularly if it happens spontaneously without you squeezing the nipple. This type of discharge can indicate the presence of a tumor in the milk ducts. Discharge that's less concerning but still worth checking: milky discharge from both breasts, greenish or yellow discharge, or discharge that only appears when you squeeze the nipple firmly. These can indicate hormonal imbalances or benign breast conditions, but they should still be evaluated. A 50-year-old woman in Port Harcourt noticed a small amount of clear fluid on her nightgown one morning. She hadn't squeezed or pressed her breast. The discharge had happened on its own. She'd never experienced anything like it before. She saw her gynecologist that week. Testing revealed ductal carcinoma in situ, a very early form of breast cancer that's highly treatable when caught at this stage. Gynecologists recommend this. If you notice any nipple discharge, don't squeeze repeatedly to check if it's still happening. This can actually increase discharge from benign causes. Note what the discharge looks like, which breast it's from, whether it's from one or multiple nipple openings, and whether it happens spontaneously or only with pressure. Then, see your doctor promptly. Important context. Many women experience occasional nipple discharge that's completely normal, especially in the years leading up to menopause when hormones fluctuate. But the rule is simple. New unexplained discharge, especially if it's bloody, clear, or from one breast, needs evaluation within 1 to 2 weeks. Your body is communicating with you through these signs. The wisest response isn't fear, but informed action. And that brings us to the number one warning sign, the one that often appears earliest, but that too many women explain away or ignore. Number 1. Unexplained changes in breast size or shape, especially when it affects only one breast.
This is the warning sign gynecologists say women dismiss most often. And it's heartbreaking because it can be one of the earliest detectable changes. Women tell themselves, maybe I slept on it wrong, or perhaps I gained weight, or I'm getting older, things change. But when one breast suddenly becomes noticeably larger, smaller, or changes shape compared to the other, that's your body sending a clear signal that something isn't right. Here's the medical reality. Breast cancer can cause swelling that makes one breast appear larger or fuller. It can also cause the breast to appear smaller or distorted if the tumor is pulling on surrounding tissue. You might notice that one breast sits higher or lower than it used to, or that the curve of the breast has changed in a way that's not symmetrical. These changes happen because growing tumors displace normal tissue, cause inflammation, or create scar-like tissue that pulls and distorts the breast structure. Sometimes the breast looks rounder or more swollen due to blocked lymphatic drainage. Other times, it may appear flatter or deflated in certain areas. A 48-year-old nurse in Enugu noticed over a period of 2 months that her left breast seemed fuller than her right, and the shape had changed. It looked rounder at the bottom. She knew breasts can be slightly different sizes, but this was a clear change from what had been normal for her body for decades. She didn't wait. Screening revealed inflammatory breast cancer, which was causing the swelling and shape change. Because she acted on this early sign, treatment began immediately. Gynecologists emphasize, take photos. Once every few months, stand in front of a mirror in good lighting with your arms at your sides, then raised above your head. Take photos. These photos become a baseline you can compare to later. Subtle changes in size, shape, and position become much more obvious when you can compare current appearance to photos from months before. It's also important to mention that many women naturally have breasts that are slightly different sizes. That's completely normal if it's always been that way for you. What matters is change. If your breasts have always been similar and now something is different, that needs evaluation. The same goes for changes in how your breast feels overall. If one breast suddenly feels heavier, firmer, or warmer than the other, these can be signs of inflammation related to cancer. Here's what leading gynecologists want every woman over 45 to understand. Your body is extraordinarily intelligent. It sends signals when something is wrong. These 7 warning signs we've covered today are those signals. Some are subtle, some are more obvious, but all of them deserve your attention and prompt medical evaluation. Let's review the 5 early warning signs of breast cancer every woman over 45 must know. Sign number 5, changes to the nipple, shape, position, or appearance. Sign number 4, persistent, unexplained breast pain in one specific area. Sign number 3, swelling or lump in the armpit. Sign number 2, unusual nipple discharge, especially if bloody or clear. Sign number 1, changes in breast size or shape, particularly asymmetric changes. Here's what I need you to understand. Finding one of these signs does not mean you have cancer. Many breast changes are caused by benign conditions, cysts, infections, hormonal fluctuations, or normal aging. But you cannot know the cause without proper medical evaluation. The women whose stories we shared today survived because they didn't ignore the signs. They didn't wait. They didn't convince themselves it was probably nothing. They took action, and that action saved their lives. Early detection is everything. When breast cancer is caught in its earliest stages, the 5-year survival rate is 99%. That's not just a statistic. That's mothers, daughters, sisters, friends, and women with full lives ahead of them who get to keep living because they recognized a warning sign and acted on it. If you notice any of these signs, make an appointment with your healthcare provider within 1 to 2 weeks. Not next month, not when it's convenient, within 2 weeks. And if your doctor dismisses your concerns, advocate for yourself. Request imaging. Get a second opinion. You know your body better than anyone else. Now, I want to hear from you. Have you been doing monthly breast self-exams? When was your last mammogram? Drop your answers in the comments below. And if this video helped you, share it with the women in your life, your mother, your sisters, your friends. This information could save someone's life. Don't forget to subscribe to Silver Wellness Channel and hit that notification bell. In our next video, we're covering the 7 risk factors that increase breast cancer chances after 45, and more importantly, what you can do to lower your risk. You don't want to miss that. Stay aware, stay proactive, and remember, your health is your most valuable asset. Protect it. Thank you for watching, and I'll see you in the next video.